So, I'm going to talk about the neurobiology of addiction, or Addiction 101. And the reason that I do this lecture specifically is because we talk about addiction as a disease, but we don't treat it as a disease. And we talk about how addiction affects everyone, and and we're saying it's a disease process, but nobody really treats it like a disease process. And they say things to me like, "Oh, it's not as bad as cancer, right?" Well, no, a disease is a disease, and I think that people need to understand that if we're going to get rid of the stigma and start treating people with addiction appropriately. So essentially, I am the board certified in family medicine as well as addiction medicine, and I work at a whole bunch of different treatment facilities dealing with addiction all day, every day. These are just some objectives and disclosures. You can read at your own risk. So the disease model of addiction, the disease model is what we use in medicine. So the disease model essentially says that there is an organ, there's a defect in that organ, and there are symptoms because of that defect. So in order for something to qualify as a disease, it has to fit this model. Diabetes, the organ is the pancreas, the defect is a decrease in beta islet cells, the symptoms are high blood sugar, coma, retinopathy, etc. So, but all diseases, if we're calling them diseases, fit this model. They have to fit this model. And there is no continuum. It's just, it's a disease or not a disease. So the question becomes, how do we get addiction to fit this model? So addiction is a brain disease. We're starting at a disadvantage. It is not a purely psychological disease or illness, which is what everyone believed previously. It is a neurological disease. There's actual change in the brain that occurs that results in addiction. So we're starting at a disadvantage because brain diseases often manifest as behavior. So you see someone with a brain tumor or a lesion in their brain, they have personality changes. They behave differently. They can become impulsive or angry or difficult. But we excuse it because we know they have some kind of tumor, or they got hit in the head or something. But with addiction, we have a tendency to point at the addict and say, "You're bad, and this was your bad choice." But the disease is occurring in the brain. So, in addiction, we deal with two major parts of the brain, the frontal cortex and the midbrain. So the frontal cortex is the part of our brain that makes us us. It makes you you. It's where your superpowers are. It's your personality, your values, your ethics, your morals, your willpower, your sense of choice. It's all conscious. It's where you think. And I use Superman to represent it because it's your superpower. A fully functioning frontal cortex, like everyone in this room right now, is like a fully functioning Superman. An addict or someone who is frontal cortex is not working properly is like weak Superman. I just need to simplify it with pictures. So the midbrain is the other part of the brain we deal with, and the midbrain is your survival brain, and it's kept us alive for thousands and thousands of years, so it's doing a good job. But it is not conscious. You have no control over it. You can't fix it or change it or tell it what to do. Its role in life is to keep you alive. That's it. It doesn't weigh consequences. It doesn't be like, oh, maybe this. No. It says we're in danger. We're going to die. I have to take action to save the life. So I use the tiger. It's a more primitive part of the brain. So an angry tiger, no one in this room has right now. Angry tiger is you're in the woods and the bear's chasing you and you're scared and you're going to die. Okay, angry tiger is an active midbrain. So the midbrain has three functions: eat and drink water to get nutrients, fight or flee from a predator, and procreate. That's it. Those are the only things it does. So when a baby is born, one of the first things we do is we feed it. And the reason that we feed it is because giving the baby the nutrients releases dopamine in the midbrain, it activates a reward system, and the baby essentially becomes addicted to food. We have to get the baby addicted to food because if the brain doesn't think it needs it to survive, the baby won't crave food and it will die. Drugs of abuse work in the midbrain. And drugs and alcohol, for all intents and purposes, are exactly the same thing, and I will explain why. Okay, but drugs that people abuse work in the midbrain. For years, we thought they worked in the frontal cortex because we thought addiction's a behavioral disease. But what we found is that if you put probes into mice brains, into the cortex and into the midbrain, and you give them the option to hit a lever to administer cocaine directly into their brain, only the mice that have the probes in the midbrain will actually do it. And they will do it to the point of death. They will do it, they will not eat, they will not sleep, they won't do anything else. They will just administer cocaine until they die. So mice get addicted to drugs, but mice don't have, like bad families, and they don't live in bad neighborhoods, and they didn't grow up in the foster system, and they don't have no money. So this is not about, anything socioeconomically. This is not about race or culture. This is simply about neurology. So what happens with repeated use of a substance that's activating the midbrain starts to believe erroneously that it now needs a high-level dopamine-producing substance just to survive. So it gets hijacked, basically, by drugs. And so once it believes it needs high-level dopamine just to survive, it will seek out the high-level dopamine in any form, which is why it doesn't matter, alcohol, marijuana, cocaine, heroin. There's no such thing as heroin addiction or alcohol addiction. There's just addiction. Because if heroin is what caused the change in the brain, alcohol will cause you to go back to heroin. That's it. It doesn't matter that in the past you never had a problem with alcohol. It will lead to relapse because it works in the same exact place with the same exact chemical. So the example I always use for people who are not addicts is if you're dying of thirst in the desert and you're on day 5 and your organs are shutting down and you are about to die, and I hand you a bottle of water and I tell you I'm going to take your kids and your job and your house and your family if you drink the water, you would take the water. Everyone in this room would. I don't care how much you love your kids and your job and your house, you would take the water. Because the part of your brain that values your children and your family and your career is your cortex. During times of survival, that's shut down. Your midbrain is what has to keep you alive, and that doesn't care about your kids and your job and your house and whatever. So you'll take the water, drink it, satiate your midbrain, and then your cortex comes back online and goes, oh my God, I can't believe I just gave up everything for water. And you try and manipulate me into giving back your stuff. So we can see on a brain scan the difference between an addict and someone who's just using drugs. There are people that just abuse drugs. They're not necessarily addicted. In order to be addicted, bad things have to happen because of your use, and you have to be unable to stop. If you can put it down and walk away, you were never addicted. You just used drugs and maybe aren't a great choice maker. So if you put both people in a brain scanner, what you will see is for a true addict, you show them, you put them in a PET scan, show them their drug of choice. Brain scan will show midbrain lit up. Frontal cortex dark. Take someone else who just uses drugs, put them in the brain scanner, show them the drug that they like the most. Cortex lights up. They're thinking about it. I love it, I hate it, whatever. But their midbrain is dark. So you can see this. You can actually see this in brain scans. And here's just some examples of it. So a non-user has a very much more active cortex than an addict. And you can also see that it doesn't matter, even 100 days abstinent from a drug, there's still less activity in the cortex. So the damage is long-standing, and it takes a while to get better. Dopamine receptor activity is decreased in the addict. So in the addict, the midbrain dopamine receptors are downregulated. I'll explain why. So addiction is this broken pleasure sense. It's our reward system out of whack. So here's how our brains work in simple terms. We receive a signal from the environment, either chemical or electrical. It comes into neuron A. It tells neuron A to release neurotransmitter. Neuron A releases the neurotransmitter into the synapse, and then that neurotransmitter binds to neuron C, which exerts an effect. I see a hole in the floor. The electrical signal from the light comes into my eyeball, goes to my retina. It sends the signal. It releases acetylcholine or some other neurotransmitter, and then that tells neuron C to move my leg. So I step over the hole, whatever. That's really simple, but that's essentially how our brains work. So with drugs, the drug comes in, it binds to neuron A, it releases dopamine into the synapse, dopamine binds to neuron C, and it says, oh, I'm really happy, or oh, I'm really euphoric, or I'm joyful, or whatever the effect of the drug is. But essentially, it's not the drug that matters, it's the dopamine. The dopamine that was released into the synapse is all that matters. And it's the same dopamine, whether it was from alcohol, marijuana, heroin, crack, methamphetamine, doesn't matter. So it's not the drug that matters, it's dopamine. So the brain has 10 perceptual systems. Number 10 is the pleasure system. That goes back to that baby. We have to become addicted to certain things to survive. So the reward system is part of the pleasure system. Also, if you had no pleasure in life, you would have no desire to continue living. So things have to give you joy and pleasure on a regular basis, or we'd be depressed and suicidal. Dopamine is the pleasure chemical. Dopamine is what says life is awesome, this is great, we're having a great time, I love this. Dopamine is the neurotransmitter that we are addicted to, or that addicts are addicted to. Our brain has a set point for pleasure, just like we have a set point for temperature, for our body regulation. My body is at 98.5 degrees because that's how I'm most optimally functioning. I get exposed to a bacteria or a virus, my set point moves up to 101 degrees because it knows it's going to kill off the bacteria at that level. Once the bacteria is dead, drops back down to where it's happy, 98.5. That's a fever. That's how our bodies work. We have a set point in the brain for pleasure. The set point says that things that release a certain amount of dopamine are going to be viewed as pleasurable. So I can release dopamine doing other things, but if it doesn't cross that threshold, I will not enjoy it. So we have our normal things like winning the lottery or like getting married or something exciting. We release dopamine and we think that's great. Drugs and alcohol release massive amounts of dopamine, just massive amounts, more than the brain needs or really can tolerate. So what happens is the brain says, we have all this dopamine, we don't need all these receptors for dopamine. So it starts pulling off receptors. It downregulates receptors. And what happens when you downregulate receptors is you move the threshold up. So as the threshold moves up, you need more dopamine just to feel the same amount of joy you used to. Which means that, going on family vacation, winning the lottery, playing the guitar, things that used to give you pleasure, they're still releasing the same amount of dopamine, but it's not enough to cross the threshold. So you don't actually experience pleasure anymore. And this is why addicts will tell you all the time they used to love to play the guitar, they used to love to knit, sew, do stuff, and they don't anymore. Because they really biologically don't anymore. They can't get joy from it. Stress works just like addiction in the brain, in that with chronic severe stress, there's a release of corticotropin releasing factor, which causes a downregulation of dopamine receptors. So essentially, chronic severe stress leads to the same exact process as addiction. It increases the thresholds. Now, when we consider that 1 out of every 4 addicts has a history of trauma, that's chronic severe stress over time, we can see that they're primed for the first time when they use a drug, but that's the first time they're experiencing any real joy, because it's the first time anything's crossing their threshold. And then continued use of the drug just exacerbates the process and it becomes a vicious cycle. And eventually, old pleasures just don't show up anymore. So addiction is a stress-induced hedonic dysregulation. So it's a stress-induced pleasure deafness, basically. They can't experience pleasure. The other neurotransmitter I talk about is glutamate, and glutamate is responsible for memory formation. And I always say glutamate's like the executive assistant of dopamine. So anytime you do something enjoyable and dopamine comes out and says, yeah, this is awesome, glutamate comes out and says, I'll take note of it, and I'll keep it filed away. And so glutamate will start reminding you of situations surrounding dopamine release. So you go on vacation to the same place every year, you enjoy it. Now when you're packing your bags for that trip, glutamate is going, whenever we pack our bags like this, we wind up in Disney World and we like that and there's a lot of dopamine, so you start to get excited even before you go, right? So when addicts use drugs or alcohol in the same exact place or environment or with the same people in the same house, they drive down the same street to get their drugs, they go to the same bar every day to get their alcohol, glutamate is taking note that that's where they get the most dopamine. So even driving past their favorite bar can cause a small amount of dopamine release and trigger them to want to use. The 3 things that cause relapse in humans: dopamine exposure. So going to an ER, going to the doctor, getting a prescription for a medication that releases a lot of dopamine can trigger a relapse. Any exposure. Heroin addict that goes out and drinks alcohol at a family picnic gets a lot of dopamine and suddenly can't remember why they feel so restless and irritable and discontent and why am I even clean? And they wind up relapsing. Stress. Anyone who ever knows an addict who has ever relapsed after a period of time clean, you ask them what happened, they say something stressful. Dog died, wife left, lost my job, something stressful happened. and exposure to drug cues, people, places, and things. So running into an old dealer, an old friend you used to use with, running into an old relationship where you used to use. These can cause relapse. So the midbrain knows it needs high-level dopamine to survive. How does it motivate the person to behave in a way that's counterintuitive to what they know? How does it get a soccer mom to go out and shoot heroin? How does it get the prom queen to go out and smoke crack? Craving. Craving is an active midbrain. That's really all it is. The midbrain is active, thinks it's dying. So it's going to send out physiological signals to the body so that the body thinks, I got to do something to make this go away. So it'll send out physical signals, sweating, chills, nausea, restless legs, obsession, tunnel vision, and inability to think about anything but the discomfort that I'm in. That is what craving truly is. The craving will then tap into the cortex and find a reason to use. It'll go into the library that is the cortex, and it will find a past reason that is enough to make that person want to use. Hey, soccer mom, remember when you had that herniated disc 3 years ago we never took care of? I think it's really bad right now. I think your pain's awful. Or, hey, prom queen, remember you had social anxiety in kindergarten? I think we have social anxiety again. It's really bad. You're anxious. You don't even want to leave the house. And the craving, the midbrain, will actually bring to the consciousness these things, causing the person to now give themselves permission to want to use something. I can't live in this much pain. I can't live with this kind of anxiety. They don't know that's what's happening. All they know is they suddenly have worse pain, worse anxiety, worse stress than they ever did before. And that's when they start acting the way we see them act. The loss of control, lying, manipulating. Well, I have to manipulate. I have to see 4 different doctors if none of them are going to treat my pain. We don't see all the other stuff. We don't see the downregulation of the dopamine receptors or the craving or the suffering that's going on. We see this and we think, bad, they're bad people. So the question becomes, how do we fix it? How do we bring this cortex back online? Well, after we get through the medical part of detoxing them, we have to focus on strengthening the cortex. So we have to change this idea that the drug is survival, that the drug is the only thing that will keep us alive. And so we have a couple of tasks going on. One, we have to remain abstinent because that's what's going to quiet the midbrain over time. And 2, we have to work on coping skills and stress relief. And we have to work on spiritual growth. Spirituality in the frontal cortex is the only part of the brain that is capable of becoming strong enough to overpower in a midbrain. So that's why we focus on spirituality in the 12-step programs and in most treatment centers, because we know that that part of the brain has the ability to overpower a midbrain. Not religion. I'm not talking about religion. I'm talking about spirituality. But coping skills, stress, the second you use a drug that releases dopamine, you instantly forget all of your coping skills and stress reliefs. Instantly. So we have to reteach those. Behavioral therapy and 12-step meetings, they work on the frontal cortex. They are strengthening that frontal cortex, which is the ultimate goal in addiction treatment. Medications work in the midbrain. Okay? We need sometimes to quiet the midbrain because it can take up to a year for the threshold for pleasure to come back down to normal with just abstinence. And most people can't live a year never experiencing any joy or pleasure. They just can't. So unless they're in jail, they're probably not going to make it that year. So how do we accelerate the process? Well, we work on the frontal cortex. The harder we work on that, the quicker the process occurs. But in the meantime, we may need to quiet the midbrain. So the idea behind traditional therapy, 12-step therapy, group therapy, behavioral therapy, is simply to take a weak frontal cortex and strengthen it in the face of cravings in an active midbrain. That's the idea. So over time, with abstinence, and even with medication, because the medication that we use keeps a consistent level of dopamine in the system, over time, that threshold will move back down. Now, it's friable, meaning that the second it's exposed to dopamine again, it'll move back up. Okay, it's not, even if it took 25 years for it to get here in the first place, it will only take one use for it to start moving back up again. The idea behind medication-assisted treatment is simply to quiet the tiger in the face of a weak frontal cortex. So I always say that back 80 years ago when Alcoholics Anonymous was founded, you had a bunch of 65-year-old gentlemen who had been through several career changes, lost their wives, their children, they're desperate, and they walk into a room and they sit down, shut up, and listen. And they go, all right, I'll do whatever you say, because I've lost everything. You know, I'll do whatever. Today we have 19-year-olds who lost their job at Taco Bell and mom won't let them drive the car anymore. They don't understand desperation. How do you get them to sit in a room with a bunch of old guys going, sit down, shut up, and listen? It's almost impossible. Unless you can quiet their midbrain. If you can quiet that craving and keep that under control, they will listen. They will do what you tell them. So the medications we use, obviously for alcohol, antabuse, Camprol, naltrexone, these help with cravings. Nothing really stops drinking. Antabuse is a negative reinforcement. They'll throw up if they take this and then drink alcohol. We know negative reinforcement does not work for long term, but it may be helpful in the beginning stages of recovery. And the other ones help cravings, which may or may not reduce drinking. For opiates, we replace them or we block them. Those are our choices. We can replace them, which quiets the midbrain, or we can block them, which prevents the midbrain from getting them. But the problem with with these medications, obviously, is they do nothing for cocaine or benzos or marijuana or alcohol. And so if we're not actively working in the frontal cortex, we're not actively reminding them that they're addicts, the drug's useless. And that's what I just talked about. And so basically the idea behind medication is harm reduction. We have to reduce the amount of harm they're doing, decrease the amount of overdoses by giving them this medication, saying this is not the treatment. This is simply helping you get to the treatment. So the definition of addiction is essentially a dysregulation in the pleasure system, a broken reward system. And it results in loss of control, which is that foolish behavior we see, the craving, and the persistent use despite negative consequences. Something bad happens, you keep using, it's a problem. And that is how we get it to fit into the disease model. So the organ is the midbrain, the defect is this dysregulation of the pleasure system, and the symptoms are loss of control, cravings, and persistent use despite negative consequences. And the ultimate toolbox is really a combination approach. We look at therapy, we look at 12-step groups, we look at medication if it's appropriate, and we work together as a team. Nobody can treat addiction on their own. Nobody. Not one single person can't do it. You need a team. And the only way we're ever going to really fix this is to prevent it. So we really need to start at the level of the adolescents. We're never going to treat it to extinction. I don't know how we do that. I don't have an answer for that, but that's what we have to focus on. That's that.
Thank you.
Yeah. That's a lot of information.